Disclaimer alert, disclaimer alert. Back to you again, Dr. Salem from Brooklyn, New York. And now my client, the same client, we're showing how to assist the dural rocking. He agreed now that to film him without a towel. I'm so lucky. Okay, where is your pain, my friend? With the pain?
Yeah, that side.
This side, yeah? All this, the pain is this side, yes?
Yeah.
Okay. Okay, you're gonna work in that. You're gonna feel much better. I'm gonna work without gloves. Is okay?
Perfect.
Just relax. Bismillah. Does it hurt?
No.
Good, you're strong, eh? No one's good. See, guys, one side the skin is tight, one side the skin is, you know, need to do skin stretches. This actually one of the evaluative ways, guys. You're gonna do skin rolling both sides. Check. Please do it for the patients, guys. Come in here. Don't believe the saying that the no relation between the skin and the back and no skin between the skin and the pain. Don't believe those. I'm sorry, I don't wanna speak like words. Anyway, this Lino Cheto, one of the big, scholars, when he used to come to New York, with a lot of people to go attend to him. Anyway, come here, guys, get closer. When you do skin rolling, see skin. This one of the evaluation for a back pain, guys. If you have a back pain patient, this one of the methods you evaluate. You're gonna go skin rolling from down up, and see the skin. Which one is slack? Which one is tight? Which one is slack? Which one is tight? The tight one, you need to stretch it for 15 seconds. I know it's in a book 11 seconds, but I'm telling you 15 seconds to 15 seconds. I work with my patients every day, and now been a long time, so I'm passing this information to you guys. You're gonna go again, skin rolling. Any tightness, you release it first. He's very, see now, it's very good. He's good. Okay, it's tight here, the neck, upper traps area is very tight. I think I showed you before some video when I'm doing this, my official release for upper traps and the neck. It's very tight here. Oh my God, see the left side? Yes. The paraspinal muscles, longissimus, splenius, on the side, the left side is very tight. See how I'm gonna relax my see, I'm gonna relax it. Just relax your wrist. I'm gonna press with my finger here. I'm gonna take, see, the temporal, the palatal bone, the ipsilateral palatal bone, and I press like this. 1, 2, 3, 4, 5 to relax it. This is positional facility release. But I told you before, the more techniques you know, the more efficient you will work. Because I told you before, if you press in the posterior part of the parietal, you're relaxing the smooth muscles of the posterior cerebral artery in that side. And if you press here in the coronal suture bilateral like this, squeeze it, you're relaxing the middle cerebral artery, okay, in both sides, with some other modification, of course. So if you can relax his arteries, one of the arteries while you're working, why not, okay? So the more techniques you know, the more physiology you know. This is how you relax the arteries. It's advanced counter strain technique for the autonomic nervous system. Dr. J. Amitio did a lot of researches. Okay. You have no space here between the C1 and C2. This is going to release it. He's going to lie on his back now. Going to put his head on the other side. These are skin rolling, guys. Do the skin rolling over here. This is a multifidi. I'm going all the multifidi here, going through the multifidi. Does it hurt here? Yeah, see these guys here? This could be the iliocostalus. Here, the iliocostalus muscle. See, when you have the iliocostalus, does it hurt? Yeah, this iliocostalus. See, spasm, iliocostalus spasm, and tenderness or trigger. When I press, he does pain only here or go somewhere else, the pain.
It goes down and up.
It goes down and up. This is iliocostalis. Iliocostalis can give you pain, also go to the ribs here.
I feel a little different.
Pain too here, yeah? The iliocostalis, guys, look at this. It's an iliocostalis muscle. If it has a spasm tenderness, it can give pain in the ribs, the anterior and anterolateral floating ribs, and even go to the belly, the pain. But trust me, if you just treat the iliocostalis for 5 minutes maximum. How? Press light touch hurt? Light touch hurt or no?
It hurts, but it's okay.
Okay, what a deep touch?
It hurts.
Okay, I will go with the 5 minutes here. Is it timed? Do either circular pressure, intermittent pressure, constant pressure, my iliocostalis. After that, the pain is going to be much better. This is the iliocostalis was causing him the problem. But this is what we find. If you want to filter it, guys, we're going to filter it together now. Let's work on iliocostalis for now and see. He needs also subclavian release, C1 release. I'm going to do that when he's lying supine. Just relax, okay? Just relax. Relax. Are you okay?
I'm good.
Good. Trying to release his subclavian fascia as well. My left hand is working the subclavian fascia. Releasing it this way, see, like this. This. From midline going out. From midline going out, from here. If you do this 30 seconds, it will help a lot too. This can help people having difficulty with straight leg raising. Test it. If you'll have like massive straight leg raising, you want to raise your leg straight when lying supine, just do this first and check. It might get better. In many cases, it's going to get better. See here? See how the body is connected? And I'm going to tell you why it's connected now. Because the dura attached to C2 and attached to S2. So when you move your head, you flex your head, you're actually pulling the dura and pulling the sacrum, and the sacrum will pull the ilium with it. Okay, and the same, if you move your pelvis, you move your legs, you're going to mobilize your cranial bones as well. I'm going to show this in details, hands-on, and cases and videos. Okay, those are my findings and my work, and it's copyrighted. There's something called NMT. NMT is a neuromuscular technique, but another technique called NCR, neurocranial reconstruction. It explains also based on a relationship between the cranial bones and pelvic bones, between moving your lower extremity and your occipital condyles. Okay, how is it now? Here. Still hurts or no? With the breath?
It hurts a little.
This is better?
This is a little better.
Much better. What about here? Take a deep breath now. Take a deep breath. Good job. Take a deep breath again. Breathe. Blow it out. Breathe. Breathe with it. Breathe again. Deep breath. Good job. It's moving better here. Let me see now the dural rocking. Take a deep breath now. Look at this man here. You see my hands? Blow it out. Look from top. Picture from top. Take a deep breath. Oh my God. See the difference, guys, before treatment, after treatment? Again, take a deep breath. My hand is the same. Wow. Congratulations. Again, take a deep breath. Thank God. MashaAllah, MashaAllah. Again, take a deep breath. Guys, science works. Again, take a deep breath. Guys, keep learning. I'm going to take the advantage now to speak about some people say, oh, what is the evidence? What RSCD? What is the connection of this? Guys, please, I told you before, why you learned to cook the squash but not the cucumber? What you learned to cook the mulukhiyah, but not the mint, not the na'na. How we learned that? Why you put your bread when you make the dough, before you make the bread, why you put some yeast and let it yakhmar? ليه? How we know this? We learned it from our ancestors. Take a deep breath. You want to do research? Do research. But don't stop the... Some people say that... take a deep breath. John Abledger, Lena Chato, John Mateo, the people who changed it, developed the medicine and therapy worldwide, they say they have no citation wherever. Who are you to say those big scholars like John Abledger? Take a deep breath. He was, without, the head of Michigan State University Scientific Research Team. National Institute of Health make 3 papers, 1973. Go up again, take a breath. Speak about his researches and see, say someone comes, young man coming, say that he has no citation. One of those guys, take a deep breath, sweetie, Habibi. Okay, I want to work a little bit here. One of those young people was me in my car, driving my car. Please listen to this, guys. And in New York, in the Belt Parkway, the signs, the traffic signs, which you where the directions and that are green. Then he asked me, what color is this? I told him green. He said, how you know it's green? I said, because I see it's green. I said, what's the proof? Maybe it's your eyes are delusional and you see it's green. So can you define me the green color? Then I asked me, are you driving your car? I said, yes. He said, what makes you sure you're driving a car? Because I'm in the car, I'm holding the steering, I'm driving. Say, no, maybe you're delusional. What's the proof? Maybe your mind is delusional and you have some delusions that you're driving your car. Do you see how those people here, those those are philosophical non-end. So don't let them hook you, young doctors, young people. Learn, please. Don't let this philosophical, how you know this is not a placebo, no difference between this and placebo. Okay, a placebo helps. Okay, this is placebo. So don't listen to them. I got a patient here. She came one time for diabetes treatment. I gave her one therapy. She was taking medications, doing whatever she could. She couldn't control blood sugar. I'm gonna send you her video. You can see it in my other YouTube channel. You can see my Facebook. Her blood sugar got better. She improved. She came only one visit. She paid for 2 half-hour sessions. I treated one of the first half hour. Then I told her she came second half hour. I told her already you got better. You didn't need the second half hour, and we gave the half-hour treatment. I tried to return her money back. She said no, give it to my husband, like in towards my husband therapy. Then her blood sugar became wonderful. Fasting between 660 and 100. The fasting, and post-Brandel is between 100 120, and she has no diabetes anymore. She went to her primary doctor. He told her there's nothing called treatment for diabetes by physical therapy or manual therapy. Your sugar become better because you're dieting, because of your diet. She was dieting for years and she was taking the medication with diet and was no control. So what's different then? So now when she said, oh, doctor said so and so. So if doctor doesn't know, please don't say. I'm gonna give you some of my patients' videos. Stay tuned, we're gonna see some patient videos here that will request the patient to get therapy. Doctor say no, they're gonna help, and the patient get help, and patients leave a review and leave videos how they felt much better after the therapy. So do not let the I would say the enemies of success hold you back. Learn and keep learning. Okay, what I learned from Dr. Blood, one of the big doctors, was 96 when I learned from him, from Virginia. Dr. Blood told me that his dad was an osteopath. And when he was young, his dad took him to his clinic and asked him, come with me to the clinic. And so he said, what I'm gonna do? Told him, move the bone and go home. He said, what the hell are you gonna do? Told him, but you're gonna get results. You are gonna get results. You move the bone, you get results. But I know now there's research. We need to do the research, of course. We do work with our patients. We do read the researches. But if you look at the researches, guys, there's a TENS unit. For example, TENS therapy. There's many researchers say that TENS is as effective as morphine, or even better, more effective than morphine, and strong central painkiller in case of cancer, in case of delivery, pain with labor. And other researchers say that TENS is not effective. There's no difference between TENS and the placebo. So you're going to go with research. You mean here in America, we got some doctors, primary doctors don't like chiropractor. They made a research in the emergency room. Everybody go in the emergency room with a stroke, asked him a question. Did you see the chiropractor in the last 6 months? And he made a paper that everybody got stroke. 88% of people got stroke or something. So the chiropractor in the last 6 months. Then the chiropractor got mad, went to the emergency room. Everybody goes stroke. When did you see the primary doctor? And they found more than 95% saw the primary doctor, and made the research that people got stroke, saw the primary doctor within the last 6 months. So this is nonsense, okay, guys? I saw a research in Switzerland, and the guy came in and said that no difference between Mulligan technique and the patient staying home doing strictly grazing, no difference after 1 month. Then after the seminar, mean that therapy has no rule. What we don't do? Then I asked him after this lecture, of course. He said no difference between Mulligan technique and a patient doing strictly grazing at home after 1 month. He said yes. I told him, but the patient come in office doesn't want to wait months. He's in pain now. We're gonna help him now. So what after 1 week? He said, of course, after 1 week the Mulligan is better. I told him why you didn't say that. He said, I'm gonna do it in next research. You got the point, guys? Please keep learning, keep researching, read research, but use your common sense, use your mind, okay? Okay, thank you.